Could more restrictions be on the way in Alberta? Good evening. I'm Tara Overholt. COVID case numbers are rising and the variants of concern rising steadily. And because of this, it's not out of the question for Alberta's top doctor.
What we know is that in other places where variant strains have become dominant, that additional restrictions have been required. And we see in many countries in Europe, we saw in the UK earlier this year, that the variant strains rise very quickly, and that in some cases those additional restrictions have been needed to prevent further spread and to prevent that impact on hospitals and ICUs. If spread escalates, if we're seeing the spread and the transmission of our cases, and particularly variant cases, continuing to rise, it may be possible, it may be necessary to bring in additional restrictions.
Dr. Hinshaw saying the future is in our hands, saying if we follow public measures, we can prevent more restrictions from being necessary. Today, the province reporting 692 new cases from roughly 12,800 tests for a positivity rate of 5.3%. 202 cases of variant strains have been identified. They now make up 19% of all cases. The number of schools in alert or in outbreak status growing, now sitting at roughly 15% of all schools in Alberta. The number of Albertans in hospital has gone down 5 to 285, with 53 people remaining in the ICU. 2 new deaths were reported for a total now of 1,973.
1 in 10 Albertans has now received at least 1 dose of COVID-19 vaccine. The province hitting a milestone of doling out 518,000 doses of the vaccine. More than 146,000 doses have been given out in just the last week. And the health minister says if supply keeps up, every adult in the province will be offered a vaccination by the end of June. Meantime, Health Canada coming out with a warning on the label of the AstraZeneca's vaccine concerning blood clots. After 38 people developed blood clots out of nearly 20 million people vaccinated. The warning says the overall risk of blood clots is not heightened by the vaccine, but it may cause a very rare blood clot in the brain, which is rare and treatable.
I've been making